Welcome to the Learning Pines YouTube. We hope this video helps.
You start by assessing safety and timing because immediate risks guide the fix. First, test each eye separately and note when the starbursts began and what triggers them. This helps narrow causes. Once done, stop driving or any risky task and sit in dim light for 10-15 minutes to reduce glare and strain. Make sure to record recent head trauma, new medications, or migraine auras. Those details determine whether you try simple self-care or seek urgent medical evaluation. Next, you address reversible causes with focused steps that reveal why starbursts occur. Start with lubricating drops 1 to 2 times if eyes feel dry. Dry surface irregularities often cause multiple images. Then reduce screen brightness and use anti-reflective lenses or polarized sunglasses to cut glare. These change light paths and often reduce starbursts. To test optics, do a quick pinhole or cover test. If vision sharpens, the issue is optical and likely treatable with lenses or surface therapy. Finally, conclude with escalation steps and one troubleshooting tip to avoid delays. If starburst vision persists beyond 48 hours, worsens, or accompanies pain or vision loss, you need ophthalmology evaluation because corneal, lens, or retinal causes require targeted treatment. The specialist will check refraction, corneal topography, tear film quality, and may order imaging to pinpoint the problem. If things go wrong, document any new medications, recent eye surgery, or increasing light sensitivity.
Thanks for watching. Consider subscribing if we helped you.